entertained.
Wow, good morning everyone, wherever you are. Let me hope that everyone is doing well. Kandi abantu abalahero kumwebali Holy Thursday gehoira tuli mu Good Friday. Abantu abali mukutambuza omusalaba mwebali muno kwehayo nimanya kicyanguhire abamu baliyo kunoga manyo baranduranta nitambuza omusalaba rundi kweri nyondo bateko hansi uni kole kinu betinyo mwehaireyo so mukama abagarureho hali eke kimukora kandi ayonge ko bayimucha no kubemeraho obutuni kugenda mu Easter obwire buno. As usual, I'm your host TRINAH mwin program ya Free Talk, and today tendinyaka mu studio nyizire na guest wangu wakuja kweyanjura kandi mumanyire buli cyaka tanu tubantu bazaho habyo bomezi obatize health talk show. Tukutangirire muno guest
wale muno kusango.
Okay, twakuyanjuraho
wito mtekaniza amabara nyowe Bright Oscar ninira abandi ahero kunibamanya ndi musaho kasoma general medicine so nejo mukiro kino kusharinga wanenyo ebintu bimu habomezi bwitu.
Okay, tukutangirire muno bale kwijja studio za 4 TV kandi nkabulikiro so ekiro cyati ntujya kubazaho urinary tract infection. Abantu abali ahero kuno yakakuza no kambi urinary tract infection so ngo kutubungiza omusawo rundi oba murtoro acheta bata omufumu ngo kutubungiza omufumu doctor najja kutusoboraho what is a urinary tract infection nebikugenderaho byona.
So urinary tract infection buli burwaire rundi ndagamba oburwaire buli common these days in our facilities there. These days the urinary tract infections are very common. So when you see the prevalence of that infection, it is getting higher day by day. So I got concerned that we should talk about it today. So urinary tract infection, in short, you can call it a UTI. Most people know UTI. They don't know what means by UTI. So, but the UTI is a urinary tract infection. They have many types, and they are very common these days. So, nyendeze kintu ekitubanza tukibazeho kuyamba obuntu obuhansi obumezi bwekororaki ya getting rid n'ekintu ekyo.
Ntenda kumanya ngo kuziri categorized abukuba osokura UTI abayingi bamanya UTI ohura olnagama ati UTI niyo candida so ntenda kumanya mu categories ki na kaziri categorized munaka zinga.
So UTI twine UTI ezebika bibiri. Twine UTI eza hansi rundi lower UTI, twine na UTI eza haiguru rundi upper UTI. So upper UTI nizatakinga ebichweka nkaki kensigo ensigo and the ureters. So when someone gets an upper UTI, he presents with conditions like acute pyelonephritis, chronic pyelonephritis, renal abscess, and perirenal abscess. Then on the lower UTI, these are the UTIs that attack the lower urinary tract. So the urinary tract that is in the lower regions, we have the bladder, that is one, and it is the major harboring source of those microorganisms. Then when those organisms attack the urinary bladder, it becomes a condition we call cystitis. So most people get diagnosed of cystitis, but you find they don't lie in the diagnostic criteria for cystitis. So we have urethritis, and this one is more common in males. When someone presents, maybe Dr. Nimpura Ninsesa Ninsasa, others confuse it with normal pain that someone can get. But when you feel pain on urination, there must be a problem for most men. And it is very rare for a man to pass urine akahura na asas unless afunire that infection.
Okay.
So the other condition is when you get, let's say, intercourse between someone who is infected already, because majority of us males we get it mostly from females.
Okay, tumbuziha mu byogero na handi.
Okunchiguma muno. Aho kuba nyonko kumpangirwe no ugenda hacyogero tinkwija koraki.
Kustama.
But hating omukazi. That's why they are most common in females.
Okay.
Yes, so mulizo wali aherwoku abakazi ndibadwara muno UTI kusingaki abasayija.
So mu bakazi symptoms nizoza
mu bakazi more especially abakazi bakira kurwara what we call cystitis. That is inflammation of the urinary bladder. Nebafuna dysuria. That is painful micturition, no cessa, no buraki, no sas. Then they get low abdominal pain. Nebabamba sasa hansi yomukundi rundi bagamba batoronka kusinga bagamba second sas. But that is loin pain. That loin pain comes in when someone has an upper UTI, and that is pyelonephritis. It is the major cause of loin pain. Then we can get lower back pain. Nohura no sasa mugongo mahasansi, nohura owokwinama tokwenda kwimuka. Then nohura obwiro obumu we get pass in urine, or what we call pyuria.
Okay.
Then sometimes when it is complicated, no sanga ofuna blood in urine, which we call condition called hematuria. Yes.
Then how about in children? Habokuba nimanya kisoko bankia okana.
Mubana, more especially in infants, they can also get a UTI. A UTI is common in all ages. It has no specific age. Manyanyo nyine myakete nubweza kwata UTI oba nyine myakete now. Beitu obokuba oine exposure hamuntu rurwe nchimaiso wibona no koraki. So mubana abato no sanga yafuno muro no tekereza maybe in malaria, but yet it is not malaria. So UTI in children causes fever. Then omwana norora takwegonza, maybe no maybe okulia takwenda kubiria. Then the other one nibamaramba turuka. Na tandika kuturuka no tekereza either rundi arwele typhoid kandi na UTI nyine ne causing ngaki, because it is bacteria in nature majorly. Yes.
Then again, how about in adults rundi those with a catheter?
People who get catheters. That's why catheters tuseme kuzikaza muno. The maximum should be 2 weeks.
Okay. By the way, tsoko bantu bazaho catheter abantu bali ahero kutakumanya
catheter kali kaseke akatukuteka either mukitweka cyawe cyama kurora wasesa ubo kubolemeriro kusesa rundi habwendere zinde zikoleka ntukorake nkabasaiza umuntu wakubarwere akahagwa akabasaiza, which we call the prostate. When someone gets prostatitis or BPH, that is benign prostate hyperplasia, most especially in elderly, they get that urinary retention, so no sango mtere makaseke. When you insert the catheter or akaseka nikaleka, you may push organisms from the tip of the private part and you penetrate inside, moving with the catheter. On the tip of that catheter there is always something you have to put so that it goes smoothly. But when you injure somewhere, directly the bacteria will do what? Will penetrate into that system. So no sanga someone has gotten a UTI just because of negligence of the medical worker and even leaving the catheter there for long. Yes.
Okay, so is pregnancy a risk factor for UTI?
It is very, very much, and how can I even say it? But it is too much. In fact, majority of pregnant women, they always get a UTI. And it is very rare for someone to finish all the 3 trimesters without getting a UTI. Reason being, they are always having a weak immunity.
Yeah.
So when you have a weak immunity, even the bacteria, all the normal flora in your system can turn and become hostile. So you have to keep someone's immunity. That's why we give some medications during pregnancy. Yes. Okay. But it is always common in pregnant women.
mwerinde muna bained so leka tubanze tugenda umuranga kama baitu niko tugakane kicheke kindi.
Good morning, good afternoon. Thank you very much for reading my book. And I'm delighted, humbled, and excited to know that you still need more copies. We printed this book in South Africa, but we plan to print it in Uganda soon. At the moment, there are a few copies left. I have a few copies left. But when we print more, then we'll put them in the bookshops. That's all I can say, but I'm very happy, delighted, and humbled to know that you actually like and want my book. Thank you.
Welcome back from the commercial break. Tugenda maisa na program yaitu eno tubazaho a urinary tract infection iwo wali ahero kuno ikabuza no gaba oba bino biki oba abantu abengi bamanyangwa kandi dagini UTI so no sanga ngutikire kichionka oyine kwega kolirizo musake kichenyini cyakorake icyakusobora nuko kamanya kuba abantu mugenda ni mutabya ebintu kintu mukikachogendo kakaguzo ketegereza so iwe no kole chacho kwenda. That's why doctor, you see most of the people mbenda muno self medication ole wakura ya sasa mukachogena akaguza doctor akagamba kanimpura ni sasa kuna kamsobora gani sasa nante baka kuchekinga huo barakura ya sasa kanimpura ni sasa alo mtu nabo ino akagama na sasa munu then no wakuba na assess yagamba huwa nyowe merana kamera pyrox kama usasu ugenda. So those are the people abatambara nabo like abatukuba nabo. So kweyongera maiso kutusobora what are the causes of UTI?
UTI is caused by many factors. We have a condition which we can call acute and complicated UTI. This one is majorly caused by microorganisms. Arahakahuka katueta Escherichia coli, rundi E. coli in short. Akahuka ako kaina ebichweka kinana hachikumi mukuleta UTI. Kandi majority abantu abakuchecking when we go into deep testing, like when we do further testing and investigation, apart from this normal test you come makugamba nohura no sasa nimpura ni korante nimbani magamba leka taking excess out there, and then after like 20 to 30 minutes bakuha results. That one does not determine the causative organ, but there is a test that we always do, which we shall discuss later. But there are many causes. One, a female can get it from dirty toilets, from dirty bathrooms, sharing buckets or basins and the other things like towels with someone who is already infected. Yes. Then the other thing is sexual intercourse. These days people don't bother. Once they test Sanga someone has got a girl or a man, they test only for HIV. Because people I don't know what testing, but majorly they always test for HIV and forget so what kingire sangoli mu mezi tena HIV, then they think that person is safe. So they forget that there are many organisms you can get from sex. So majorly, like a man, as I told you before, if you have sex with a female who is infected, you are exposed to get that UTI. Then you can get it through like catheters we had talked about, or then others are hospital acquired. There are organisms which you get from the facility. No sango izire, yes, you have a problem which has brought you to the facility, but you pick another organism.
True.
So majorly, the other causative organ takes 80, then the rest take 20. But you always contract it like through 4 routes. We have the ascending infection. That means it spreads from the urethra and goes to the bladder. Then the other one is the hematogenous spread, which is spread through blood. That's when you can get that microorganism. Then the other one is the lymphatic spread, and then direct contact of organs. Someone who has a PID of a known cause can get a UTI. Though a UTI can also cause a PID or a pelvic inflammatory disorder. Yes.
Okay. Wow, that's good. So those outside watching us can hear enti ebintu bino muliyoni mwegalo kabeke garukira hano. No burofu nabo mbuleta UTI.
Muno.
Oburofu no sanga omwisiki no jwaranika ojo okjoire kirokino. Nyencha tojogeze no gihaino ngano gijwara no gitera tera maka perfume. No sanga wahimbeki UTI. Abamu no yo gym nikate yomere no gijwara. So nabantu abamu no sanga ni munaba nabuno busabuni bwanyo manya babweta bata.
Timbo manye ni wale mukazi no manya.
No bunabera kimu no naba so no sanga naka eke kyakubeire kuyamba ndo buko bakube obunto bulikuli ngo kubamba tsoboraho bakube mukuyamba kulinda abaisiki we are not easy ekitulakatoleke kigenda homuno ntwenda kurora how can UTI be prevented?
There are many ways. One, the simple and something that is not costly. You take a lot of water. It helps you to wash the urinary tract. So nkimaiso huko kusingo kwingeza kumano koraki. Then the other one, if you do like post-coital voiding, rundi kusesa hanyuma yokuterana. Owokuba like heart for a man, na abaine as in how God created us, we are created with a long urethra more than females, because the females, the reason why they always contract a UTI quickly, because they have a short urethra. So as a man, when you finish intercourse, even a woman, because once you have intercourse with someone, direct contact, it means the fluids that you will be sharing. So immediately after the act, you can do voiding or urinate. So it helps to wash away the infections before they ascend into the bladder. Yes. Then the other one is keeping our undies or underwears clean. If you have washed your knickers, people think they can't be ironed, but you can.
Yeah.
Wash them, put them under sunlight, they dry. Then you iron. It means you will not get a UTI quickly because you are always clean. Then the other thing is having limited partners. No sango mwishyali aheroku ena wojonka batano. Ono wisoko no wa perfume ono wa so buli muntu namuleteraki. So in the end no sanga akahuka ako kakoraki.
Ka spreading.
Akahire muntu yakatwara mu abale bandi so nkagenda katikati.
bona mbashimbalia
kugira omuntu omu mukaija for check up. It is always good omuntu bwa hati nkanyo okunsanga irwaro tinso oizire ku checking HIV. Yes, I advise you on other things. Or checking HIV, then you are not going to protect yourself. Kuba no maya to kuja kutwara HIV or you already free and safe.
Yeah.
So nkimanyiso obuko obundi no obundi otabaliza okakino noja kuba no koraki
no twa.
So if you check up, do anything that it takes. Because if someone loves you, there's no need to rush. Muraba kokino mwine sente zokora HIV yonka nyencha mfuneza I like that. No mwezi nugua no mwaka nugua, then you are safe and protected. Yes.
Okay. Wow, that's good. Kandi kakuba omuntu ali aheroko ahura ngo heart signs eza ahura yatanika ku ichinga hansi ahura kale signs zaije za UTI. Kintu ke cyasemeye kubanza gukora
kuhura waliwa leka kwirukira drug shop wende ya pharmacy ganye ni mpura kuli waliwa no genda magamba kwatakano gendo kateka hansi yoko ngija kole. Yes nikija kwa but you are doing something that is harmful to your life. One of them, you are developing resistance. Your body will start being resistant on medication because of self-medication. No sanga no ejanjaba wenka tomanyire kichi chenye. If you come for a checkup, it is always good to check first. Because when you take medication, you don't know the amount of the bacteria or the causative organism you have. Majorly people who get that itching are having vaginal candidiasis. It is always in females.
Okay.
So no sangoli niliwaliwa ni mpura discharge nija nensiasi najagrati naga pharmacy mamuhayo mjum na tekana. Then in the end, in the due course na developing what we call a complicated UTI. Eyakulukira munebinde tukija kubaza mu maiso.
Yes. Okay. So ebinde bino twenda kuchano kumanyaho kakuba oli agumanikiro ile cha UTI kika habwira haluha abamo bahika ata ahika no kutandika kufune kutunga ebihoya hansi nkiso kurugira muki.
So when you get the UTI and poorly manage it, you get complications. Yes. So there are things that come in. First of all, let me start with us males. Oja kubolia off na UTI from somewhere, then ugumenai. Ogendo hura wa sasa kusesa no sasa. Jagena ngula kapanado. Nkamiro sasa ukolek.
Okay.
Unless most in fact abasaija abakusinga abaija mu irwaro kuchekinga for urinalysis. Nchimanyisa babandize kuhura signs z'abanyingi. Abamunorora bafunire pass. Ole wakwimuka akasanga cyoka byaroho kamasese natina beito gwako bino usase na mera panado. So kirungi muno koraki kwijo kabanzo ka checking. So mubasaija major complications nyingi. Echimu twine reduced libido. No hura engonzi za mchara wawe nizikoraki nizikeya abandi amani gakeya kandi in the due course nikimalira kirekere no kutazara.
Okay.
So when they progress normally ofunireke something we call secondary infertility. Maybe waliozairaho but now tokoraki
tokuzara.
So nkimanyisa obora bota checkingira kurungi okajanja bwakakera. You may get such a complication.
Okay.
Females, females also can get infertility. Then the other thing, like for pregnant women, they can get miscarriage. I can cause a miscarriage. Enda ne malaria kozerek. Then umsaida na gambenda yango kozerek. Ogiremo kabuta kunyendo. It can di no sanga taliniwe tomanyine kozerek. So tuine kukora kitu ajanja boburoiro bukurara kwa kera kurungi. Then ekintu ekindi we have pelvic inflammatory diseases. Nizurugiramuki mu UTI. So a pelvic inflammatory disease here is much more worse than kuleta infertility in women. Ne young woman.
Okay.
when you have a PID katugambe nka otungira obuhuka bwa sendinga, then the uterus part of it yazim kimaisa takuja kuhimba mwana, then in the end nolema kuzara because you poorly managed some small condition.
Abantu batankaga family planning.
Mbagamba anyo kabada family planning for this time ni yakola family planning rarely causes that because they are just hormones that we always give you. So family planning cannot cause that. It can make you fail to conceive for a short period because of the hormones that you have that prevent pregnancy, but they create infertility.
Okay.
So a UTI can do that.
Okay.
Yes.
Wow. So bembe kaguzo lya hero no gambo te abantu bayingi tebakibazeke bagamba ngo nyowe family planning ni za kozereke za mbulizo ruzaro ngwenyanza. So no sanga ngo ina munebiroi ebindi byabyo takwetegereza nibyo bikozereke kandi by the way doctor, there are very many people abakurwara no sanga afuniki UTI afune biki tebakwenda gya muirwa naija nagamba nagenda nyoba mpe yo butuma orwaire kya nyoba butuma kabumanya
abokusinga wakitwara nkakantu akataito umuntu najanja wa malaria naleka UTI akuba narora akapaini amizire panado kakoreka kakuwa betubuka bulinka munda muliwe so naguma na butwara ati
na supply
akuba ati nko murwire ubora gendo kasesa nka access rundi okastama toilet nchimaiso redo bora sesa no sigaho huko hati nko mukazi wa kwiza akongera akastama mbero murwire gwagenze kwa kuba na sesa at the speed enkali negaruka na uhuka so na malira wihira then abutwaranka umunyoro muka
awake munyoro ataleta kano sindika mwito mu bakazi
abo kuba ni nyomwine risks nyingi.
Okay. So kakuba mbandi mukazi nyowe nagenda like for treatment ndwaire by the way ntakaike na hali yeki chances ezo mukazi kuisomurwe kuisa omusaijawe zirina kazinga ziharetic obwakuba kyatandikire habwokuba obwakuba katugambe maybe you oli mukumere emebazi there are some ladies nabanatina nagamba mfunire kino ekirwaire omusaija mugambire ento obundi tali nuwakiresere rundi omusaija nuwakiresere nawo nabanakola kinatina so no sanga iwo genzero tandikire emebazi baitoli to mugambire ali mukumere emebazi then he still having a sex so chances ezo kumwisa nziba ziri
haiguru habwokuba remember you are treating something then you again adding something nkima isembazi tekuja kuyamu nija kumzao hura wa relieve but in actual sense tokeze abakuba omusaiza gwakubale wao iyo kuja kuro burwaire ngo mukazi it takes some time unlike us omusaiza ka staff na UTI it is always faster in growth then nachura na wangu kusingiwe so hati yumbero gamanyo kamire mbazi already all your maze correct so bokuterana nawe ola mbazi yao naenga na kugarura no sana kujanja bano ngera no leta kirinko umuntu kubanolia so ncheche
okay
o inacto sense tenechokoze
okay so halo muntu akabali mukabuza akasenga message nakabuza ngo kakuba ojwara pads okazima zayo wire nazo nzikuwe nazo nzireta UTI
at pads pads are always clean that is one taroho kazo kuja kujwara pad kirokeno nyencha akajigara
the whole day
yes unless these reusables but they always clean them so obo kugambo zwire pad
akola kagamba kagijwara like yagimara buli gijwara nafuna UTI tinkumanya abwaki baitu buli gijwara
ofuka nasangwa wine tukule gamba mu pad diye bulesere akuba pads are always safe and they are clean they don't have an organism or you could kuleta they are always sealed in a good packaging So nchiguma muno gamba padi ya detero fuka paka nawe nembera wihira hand.
Okay. Wow, that's good. So nka UTI nosanga bantu bengi nosanga ono agine. Then halo abantu abamu nosanga katugambe ne ka boyfriend. Omusajja sokuba abwine. Baito mwisiki to mukozeki tabwine no mugia mkachekinga nosanga takozeki tabwine. So is it as advisable, or is it good like to be with that person? Akwalo abantu abamu no huramba gamba ngu nyowe nangwa nyowe ngira UTI wete yange tena teture guma mutinguma ni sasa ukatito mpuwa
nangwa amazima gali UTI etura nchiguma muno gamba omusaiza n'omukazi bekera hamu baterana basanga omwarwire omutarwe. It is not like HIV where we have discordant couples. Mbere okusanga omwarwire omutarwe. But a UTI is always shared. Once you have intercourse, unless abakuba bali bezira abo omutarwe omwarwe ne baba bebakozesa protection yona nka barrier kuleka omukazi n'omusaiza tubakorake tubafuna contact yona baitu kastabaho any contact physical contact yona ataro barrier between paka nofuna UTI.
Okay, then when you're on treatment wa malaria treatment ya useme kutwara bwire kikura wayongera kwa having sex with your man utakatera ine nawe rundi oine kubanza kongo kagyoka oka meeting a doctor rundi iyo kasto yehura yoke dozi yawe hoireyo
no, so now that one has been a challenge. No, a couple comes, you check and diagnose someone having cystitis. So no bahemibas. After giving them medication, na bagamba keno muchikole muti na muti keno mukole muti na muti busakuterana embazi atakahoire muramale embazi mwije twongera to reviewing. Niba lema kulirize kyogambere kukikora kiteka mu nkora. Niba malira bongire baterene in the due course. Then obakwije musawo tutakole kintu cyone.
But
tulemera kukira. Yet they know what they did.
Yeah.
So we're kusingo wing. It is always good customer kutandika emibazi. You first chill the things of direct contact with your partner. Some of them, if it is unavoidable, you can use a condom. But unless otherwise, you have to stay aside from that. Okay. Then after the treatment, we always give a few days. You come for checkup and we declare you safe.
Okay.
Yes.
Wow, that's good. So mukurora nka UTI abantu abenge no sanga agine baitu nkireterezwa kusangwa mba mu treating arundi tayine cyamane cyakora like having sex na patanawe baitu no sanga mba mu treating nayongera hoiroho bwire na hura egarukire nabayongera giseruire rundi.
There is something we call a recurrent UTI. UTI a recurrent ni ya kugumanija like someone having more than 3 symptomatic UTI. Symptomatic UTI ni yo kind of UTI yokusanga upuka mukiseso. So every time you check na usanga kimaisa that person is having a recurrent UTI despite of the therapy that was given to that person. So what we always do, we always ask for those people to do urine culture and sensitivity. Remember, you are taking drugs on just the amount of the bacteria you have. You are not knowing that I'm having this organism that is disturbing me. I'm having this that is causing this. So when you do like a urine culture and sensitivity, most people don't do it because of the money issues. You see, it is kinda expensive and takes time. So when you tell someone, come, we do a urine culture and sensitivity, it takes around 4 days, 4 to 5 days to get the results.
The results, okay.
Remember, someone is having pain in a discharge, so is uncomfortable. most of them bamalira bagambira nyewe doctor now nza genda hali mfune mbazi rundi mpe mbazi nyonkole
abandi bakiga kwejanza bana safe.
Safe traction is a good injection but people are misusing it.
Yeah, true.
Like a simple UTI,
na safe.
Some people do it because they need to raise something, but it is not legit. You're causing resistance to someone's life. So no sango, at a certain moment when you do like a culture, you find most of the drugs are resistant.
Okay.
No sango, what the person is left with to use is too costly than if he would have done that test before. So it is always good when you test. You have done testing, yes, in the first time. You found you are having the bacteria.
Yeah.
You are taking the medication. After that medication, after a while you again test and find the bacteria there still. It is always good to do a culture before you take further medication.
Okay.
Because the more medications you take, the more resistance your body develops.
Okay.
Yes.
Wow, leka tunge tugenda mburango wakamawita ngo tugaruke nikicheka chete cyo kumalia.
Fort TV, stay entertained.
bagira orufumu olw'abayisenkulu lwitwe oluli very meaningful olwina amakulu ag'amaanyi okugamba ngu amata gatahatwa lwagatahasireho ata kagatahatahoga tagatahata obwagatahata amata agagata kandi amata obwokumara gata tosobola kwongera okagayoramu.
Fort TV, stay entertained.
Wow, welcome back from the commercial break. Tuli mukichaka chete chokumalira tuli UTI omuntu wala hero kan hirenti. You've understood everything kandi wamanya ngeriki yosobora like kutungira mu UTI rundi orabo bine bikaguzo very many questions mu bongo bwao no gamba paitukine UTI iyo bagifuna bata rundi hiyo yange kanyenye treating ateku like tekukira ni nkora bino eremere ubundi iyo bokumakwa akajuma kawo anogendo kwenjoyinga no sanga ngo ebintu bakoraki wabisisira kim. So hati twenda kumanya management ya UTI, how can it be well managed?
First of all, we always say prevention is better than cure.
True.
Before you go to managing, it is better you protect yourself. So first do the precautions that help you not to contract the UTI. Then if you have contracted it, then you have to come to the facility. So when you come to the facility or any clinic around or any person who is of the medical sector, the thing they should do is advising you to first do a checkup.
Okay.
When you do a checkup, it means we are going to estimate or to know the amount of the bacteria that you have. And the medication will depend on the amount of bacteria that you have. People who can afford doing urine culture is always the best.
Okay.
Yes. When you do a urine culture, it always comes with a causative organism. We talked about E. coli, but there are many others like Klebsiella in the other 20% that remain. Remember, E. coli causes 80% of the UTI.
Okay.
So when you go and test and they do a urine culture and sensitivity, it may not necessarily bring an E. coli as the causative organ. There may be other organisms that have caused that UTI. There are many species that causes that. Now, like for the females, in fact, those who are sexually active or in the fertility age, they always have an organism which we call staph or Staphylococcus saprophyticus. It is the major causative organ of a UTI in sexually active females. So someone may think, may have an E. coli, which is developing much resistance this side to medication. So when you do a urine culture, it will show you that this organism is what is affecting you. Then it brings a list of medications, the ones that are resistant. The ones that are intermediate, chimaisa kuja akahuka kakange kabanza kesereka ngaba normalira dose nikagaruka. Then the ones that are sensitive, if you use that one and complete the dose, you do a test for urinalysis, you can't find any bacteria unless you have got a reinfection. Yes. So it is always good to know your checkup and know what is really disturbing you or what is in the urine that is really causing a UTI. Before you do any other thing, before you take medication, first do a checkup. There are different drugs on market which prevent or treat a UTI.
Okay.
Yes.
Preventing a car.
It is better you do a test. Otakabandiza gamanyo kanda ba pharmacy nyine ngomuzange vire bampeke docs. Da pharmacy bampeke kinna na sono sana wa green nyenda ule butumo wa green undi akaita hairwaro wabumuha sona nyencha nugo nagenda na takwenda kuraba mbintu byo kumchekingo bakyo baki na malira nugo amizire, then in the end nugo resistant to the body. So na malira umizire tachake ngamba ano uragaruke musaba ubuduma wampira kabuta cyakora already of course says mundi
okay. Wow. So tugenda ha management turolenko ku UTI yesobora kuba managed.
So we can best manage UTI in two ways. We have oral medication. Chimaisa wajakuja kumbazwa ubumota humnit depending on the severity of the condition that you have. Some may be just a 3-day course, then the other one might be 5 to 7 days, and others run to 14 days course of treatment. So it depends on the severity. We don't just give medication for the sake of treating, but for the sake of eliminating the bacteria.
Okay. So
it may help someone to get relief, but in actual sense you're not treating. Abakuba abantu akusinga obwingi kibaleta mu irwaro. Majorly it is always pain.
Yeah, pain.
Obsasi obugumizamu na miraka panadol bukia ngongera mbugaruka after way. That pain makes someone come for medical checkup. Then abakusinga when they see pass bagamba kanyurukira irwaro bangambire kiki. Pass gali nkamasira
yeah.
No rora cheka byao by'cyama hoki nkamasira. Rundi ni geija owiro bumunaija discharge okurora nkambakazi terinungi. So no gamba nyowe bulikiro kamba ntati kinu kiki na malireze. So it is always good we have IV medications which are very different that you can treat a UTI. They are very many on market. So it depends on the health personnel according to the interaction you have had together to decide which course of medication can be suited for you.
Okay.
Yes.
Wow, that's good. So nihira mahura ha UTI echota like echota hulie echota tegeriza kurungi no sobora kutera doctor ulio kamuhika akakusobora kurungi kinu kirikite na kiti nko kasobora koraki kuyambwa. So to closing this program, Dr. Wabgonde select sobora okay abukuba, you'll have even to leave your contacts kusomera abantu wala so kwenda kwiza rundi
location
yaro rundi kaguza
so kusangole ale hara munno taso kufika mbere 48 agamba kantera akasomo ofuneke. It is always free consultation at the Eye Care Women and Children Medical Services in Kitumba, or you can call me personal on phone. My MTN number is always for business. Yes. Airtel is reserved for family issues, but MTN business. Call me on MTN, which you can dial 0770-736799. Rundi noti msanju noti msanju na isatu kagana msanju chenda na mwenda. Rundi osoku tuikao Kitumba after best vocational school. Nweza kubanolo liruaro mbalieta Eye Care Women and Children Medical Services. Yes.
Numuzaza bulikimu kero.
Bulikimu chona.
Okay, that's good.
Obora bana iwe inakana mundomu oja tani continental chali taja kufuna UTI okamaliro yekwasisi.
Okay, doctor, thank you so much to enable kutumeraho then got closing a program. Rundi abantu abali ahero ku kusigikira hakintu kitubentu baza UTI rundi endoire zona no bahaboraki.
So abantu abali ahero oku nyenda kubagambira anti UTI buli burwaire obubi obukusinga na HIV imukutina akuba omuntu kutazara nikisingaki omuntu kurwara HIV. HIV has medication. I'm not saying you should get HIV. So ligamba musawa gambira HIV tikirikiziwe HIV nita. But UTI can also cause death. Like if you have the other condition, acute pyelonephritis, malaria complications in sepsis and septic shock, which can lead to death. So omuntu osemekwerinda otaroro mwana omuntu omwegomba agamba onu taroi. Most people have that thinking. Na rore ruguru na judging na gambo no ataroi, and yet that person no arwere mu kusingaki.
Hello.
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 Hello. Hello. Yes, please. Yes, please. Asaba. Hello. So, calls open by to kisana bateo wa connect wa kanosanga tizikora bamkurunga ipinki abene jagwenda kukaguza but unfortunately network ankisana tia mfevaringa so beno cha no cha malira kwabara abantu itabali ahero.
So ikinkere nimba habura otarora physical look yo muntu and you judge. The English people have a saying that never judge a book by its cover. Jakurole kitabu idepaliacho lerungi mun otakumanya kiche kyandikiro munda. So otakarozere kiche kiri heruguru manzorole kiri munda. Mazo tekerezo bunagenda nkenagirizo bomezi bwange obundarwara obunyenagirize nawo ogu aramberaho haroholi kurwara tacyakumanya
kandi bebinge
aho kuba namanya najya kumalira afunereke ondi so yiwe toliki amani. So if you a guy or a man omaliro funire something we call impotence rundi amani gakea omukazi nakoleka nagenda hand.
True.
Aho kubiwe toineche amani cyo cyamukora sente tanche cyamani betaro ebintu ebyamani mbomezi boy.
Yeah.
So tusemeire kwerinda ekinkuba terera is kwerinda kusinga kujanjabo kwa prevention is better than cure. Yes.
Okay. So thank you so much Doctor habuzo burungi obothaire kandi kanihira abantu abali ahero kumuhulirize mwegere cyora botetegerize nosora kutera ha namba za simwezi ezwa kuhaire tunogena Eye Care Medical Center Kitumba nosora kutunga buli bwetago bwona mbakwicha buli services zona oinenda noenda kuzara byone bukwatagana handa no bahikaho no genda hareri rwaro mbakora buli kimu obo burwayire ki obo liota oba muswiza typhoid biki byona bakwisa UTI genda bwangu nomanya by the way abantu abamuli ahero kumutina mugamba nyo hati nkanye nkadukita kwenda atabundikanta kumusobora busa abantu abachasingire kwa hulensita like medics so unogea nombalize kizibu cyawe na kuyamba muleke kwa tirensoni mukamalira inyo benyine. Hello
mama wewe wale program
ego wale kusima dia
ego Nivani padakirini?
Yes, please, Jackie.
Nteriwe kwa mnyanga bukuru.
Ego?
Mere mnyenda kukabuzaho omusaho oku. Utaroho ebintu bile tusobora kukozesa kwetanga UTI ezo ndagira mwirwa.
Ogerwere otakagerwere.
Ebyokulya nkate kutokulya undi natural remedies.
Okay, Jackie, thanks for calling. Leko msaa kugarukemu nohura kakagwize tahalo ebintu biona home remedies bisoba basokozesa like kwetantara UTI.
More especially ebyokulya ebine acid like ekintu ekine acid nyingi kiyamba muno kuyileka levels za acidity ya private organs increasing so acidity we kubere high nkimanyisa katika kuja kwangu correct.
Okay.
There are some foods and those which are fortified and ready on market for sale that can help but there is no major food or any specific food kuja gamba kin nenja kiria nikikiza UTI nangu majority bakera kulia bibyo kulia with data acid but in other causes of other conditions bine nabye kizibu cyabi bajakiria kwenda kutangira UTI kireta ulcers and ulcers are also common these days. Yes, okay. So the best is having protected sex to avoid the UTI.
Okay.
Or check your partner. You can make it a routine checkup. Like katugambe nyo nagamba nza kuchekingaga buli mwezi kurora either bundaba contracting irakahuka.
Okay.
Kani kaba kazi should be a routine really.
Okay.
I'll cover the sources of infection high.
Oni yakamba ngu UTI no sobora gimanya no mukano ne sobora kuleta bad smell mukano harundi.
Nango.
Okay.
It is infection of the urinary tract.
Okay.
The oral or the mouth is not related to the urinary tract.
Okay.
Yes.
Thank you so much, Doctor. Wabale kuja program wenu wabale kutuegesa bintu bingi of course tuegeremo tamanyire habukuba nusanga oliaho baitu nomanya biroire bibi mune biroire bikwata mu bitweka byansoni biroire bibi muno habukuba nko mwana weno ubuyisiki rundi omukazi rundi omusaija usemeye kuguma ninyenda kubaterera kuguma muri bayonjo making sure that wanaba kandi wanaba kurungi wayera tuleke kujwara wayojanika sahegyo maragyoja wagikamura kurungi wagijwara so abona baliyo no papa so bora banomanya ngo tomorrow ina ho kujya yojanika yawo kurungi raro janikiro bora bo ine you maybe if you have one nika janikire kurungi eyome tomorrow in the morning bora ta ine pasi ogigora then ogijwale mazikora kikuoma beito utagijwara ngo itakozeke tomere leka twege kwefaho leka kujwara nika emirundi manyinga otakajiogeze ukagitera tera perfume ukagikora
kwa common mbojo
mbate naga panty
boxer yes nasango moja jere boxer kumara wiki
tokwenda girora hano
ebe kujaho ubuko bulimu so ni chongambire they can also get it through such ways.
Okay.
Hakubo bora funaka huka kakagenda huka can live for years karoha unless okaisire with detergents undi okagoroire baitu atoguma no kujwara kimaisa kaja
Then alona banu no sanga nyo abakutina hero ekiro nibasesa mbafu musesa mbaketi so no sanga no sanga obundi haizira abagenyo obundi ole izinekiro ireche yastam habafu then no mwana nawe jya kumuhimba nawe muteke habafu ngustamo sesa so no sanga ngo hati family yona yeyeto
mugenya
agreti family yona leka twegende sereze ebintu ebimu
tene kintu kindi presenter abasaija leka tugende tusarwa akasusu kaitu ako
bayida we kibazi
nikaleteraza muno kwa kurofuko omusaija wasazirwa ejagaterane no mukazi arwe but waramara terana na wakasesa chances ziri low kugamba yakayihayo beto omuntu ruine ekisusu atasazirwa aramara kuterana no mukazi obundi musigara mu kisusu so no gwakugamba ya nkokungambire prevention ya sesa amazira kuterana nikajya kusigara mu kisusu hati yako mu kisusu nkongera akatemberwa so no sanga agambe nyoti nechimbe nyonko zire ko kumsawa ngambie beto kirungi muno if you do circumcision it is done in many facilities
kweli nyonga nkabani manyana abaseja batasazure tibali no kuba yabo kwa nura sazure omwana mbamuzara mbamusara so tinkumanya abo batasazure mbakikora bata akwendo ile basta so laka bambi habo bwire thank you so much for watching, thanks for loving Fort TV, thanks for loving our programs kandi programs nyingi eziriyo nzija bakutambuza umusalaba leka tubasabire enjule yatagwa boto mkama atuyambe hakiba kutambuza kurungi then haliyo overnight abantu ngende musabe
no weto kweri
chachiki
Rivers of Life Ministries na branching ra mugasya eriyo kero kinu kachwa meeting
ko okay so mwije mubwingi leka tugende tusabe leka abantu mwejumbire kusaba by the way hata bironka bino mwezo kuba gwaje kuhwa twaje kutaha mwezi bundi make sure that at least omwezi ogwa gutaha mu osabire nuko mukama nakutemere mahanda mu buli kimwe cy'abantu ukora kuba iwe January to January iwe tosaba maybe osaba Christmas urundi idio we hikani bogenda muzigiti ngwakangenda habuko bayineki wa flower nebindi ogira gusa so leka tuleke kwetwaza tuti let's pray leka tusabe leka tuheyo maisogamu kama mubironka bino leka tusibe nuko nawe atutemere mahanda so bambi since it's a Friday, let me wish you a blessed weekend, happy Easter. Ababona mujaguza kurungi hataruga mu bizibu
balaza batajana UTI
drink responsibly, mwenjoyinge mpora mutaleta zi UTIs kandi bizibu bikeyongera. Okay, so bambi have a blessed day, bye.